So let's talk about today's task force report, Prime Minister. Inadequate provision, worsening outcomes and an increase in the number of people committing suicide. That's the verdict of the task force on mental health since 2011. Why have you allowed this to happen since you've been Prime Minister?
Well, it is a very powerful report and it shows how much more we need to do.
It's very damning.
Well, it tells us what we need to do. And yes, we should be frank. We've not done enough to end the stigma of mental health. That we've focused a lot on physical health and we haven't as a country, as a nation, focused enough on mental health. Now that is changing.
Let's talk about a specific case which I know you're aware of, which is the case of Ed Mallon, the son of Steve Mallon, who wrote to you. His 18-year-old son, presented as a clear suicide risk, was given a strip of pills and a couple of website addresses. And very shortly afterwards, he took his own life. Can you pledge that by the end of your tenure as Prime Minister, there won't be a lack of care for young people like Edward?
Well, of course, I can't pledge that there won't be tragic events like that, because there will be. But what I can pledge
is the lack of care I'm talking about.
Yeah, absolutely. What I can pledge is that we're going to expand, for instance, the talking therapies that I think have been so valuable for so many people. And the money is there for that. As I've said, 750,000 more people already accessing talking therapies. For the first time ever, waiting times rather. So if, for instance, you have psychosis, you should get treatment within 2 weeks.
When you say 2 weeks, the average waiting time for a child to get access to therapy is 32 weeks.
It's far too long, and that's why we're putting in the money. But as I said, not just money, it's also saying, we're very familiar with the waiting time targets for physical health, that you shouldn't have to wait longer than 18 weeks for your treatment. We're now doing that for mental health as well.
The task force report recommends that no one should have to wait longer than 2 weeks for access to therapy by 2021. Can you pledge that that will happen?
We can only pledge what we can afford. I don't know that I can make that specific pledge, and I don't want to say something on your programme that I can't deliver.
Let's talk about another recommendation in the task force report, which is to end the situation where children and adults are sent out of the local area, sometimes hundreds of miles, to get to an acute psychiatric bed when they are in crisis. The task force report recommends that that system be ended by 2021. Will that happen?
Again, we accept the report. That's what we want to see happen. At the moment, people are having to travel too far. If you look at, for instance, children and the mental health bed provision, there's actually more bed provision than there's been in the past. But we're also seeing, frankly, more children presenting with mental health problems. If you look, for instance, at eating disorders, we've seen a big increase in those, so extra money and extra work needs to be done. But yes, we accept what's in the report. Now we've got to work out, have we got the resources necessary to deliver what they're asking for?
I'm slightly puzzled because I put two of the recommendations in the report to you, Prime Minister, and you say you accept the recommendations. But what are you actually going to do?
Well,
which of these pledges are you actually going to fulfil?
We are going to spend £1 billion extra per year over the coming period in order to deliver 1 million more treatments. And we're going to go through this report, and as we respond to the report, we'll be able to say exactly which of the recommendations we can meet and how quickly we can meet it. We want to end the stigma of mental health in our country. We want to ensure that parity of esteem that we've all talked about, but previous governments haven't been able to fund it and deliver it.